I remember the kid sticking his foot out, and I just remember falling, and I didn't think nothing of it. My hand started to hurt, and I thought, well, you know, I broke my finger, and I spent about 8 months trying to find out what it was. It was called reflex sympathetic dystrophy at the time. When I was tripped at work, I fell and literally fractured this finger. And within a couple days, it was huge, and it was purple and blue, and it was ice cold. And they did everything that they weren't supposed to do. I've learned now, however, that if you do get chronic regional pain syndrome, they can turn it down like a light switch. They can keep it down without having to let it grow. But at the time, they didn't. Pretty soon my hand hurt, then it was up to my elbow, and then it gets so, it just spreads like a ugly disease. It spreads until both arms were just, I didn't want to do anything, didn't want to go nowhere, and that's just how painful it gets.
When I first met Anna, like a lot of chronic pain patients who weren't doing very well, she was someone whose identity had been changed by this upper extremity injury that she was experiencing. A lot of what she was passionate about had been taken away from her. She wasn't as active in her children's life, and she was, I think, suffering both physically and emotionally because of it. I kind of first had to sell her on the concept of hope, that there may be something different to do besides eke by on medications. And the medications gave her a little bit of relief, and so she kind of clung to that little bit of relief. Her life became focused on that rather than the things that it used to be.
I started out with OxyContin. I would have to say it would have to be over 400 milligrams a day, which, you know, as I understand it, is like kind of like killing a horse. My kid was going to play a state championship hockey game, and I wanted to go, and I felt so bad. And part of it is, half of it's the medication makes you so tired, makes you lethargic, you just don't want to go anywhere. You can't really think straight, there's just so many things you can't do, and you learn to live with it. But the other part of you says, you know, I used to do all these things. I used to be able to get up and do this and do that, and now I can't. I guess I just reached a point where I thought, this is just stupid. This is just stupid. My life has disappeared.
If patients are on opiates long enough, the longer they're on them, the less they will do for the patient. That's not the patient's fault, that's the way it is. People naturally develop a resistance to them. If someone is in chronic pain long enough, I think it's probably natural that they may start to develop depression or have some emotional issues because of it. And opiates a lot of times interact with some of the medications that are often given to treat that. Most significantly, there's a phenomena where if someone is on opiate medication long enough, the medication begins to change their body chemistry so that the patient's ability to handle new problems gets compromised. So, meaning if someone like Anna is taking opiate medication for her arm pain long enough, and then something new happens, say to her leg, well, at that point, if Anna stubs her toe, it feels like she broke her toe. Or if she broke her toe, it feels like someone cut it off, because her ability to handle new pain problems has been compromised by the medication she was taking for the old problem. Opiates are used as a substitution for other treatments. I think it's expected that if someone has pain for a long time, it's going to eventually affect them emotionally, and sometimes pain medications are used to treat anxiety or the depression that comes with chronic pain.
Experience the Pain Center of Arizona and get back into life. Call 1-888-PAIN-CENTER.
The day I saw Dr. Buchloz, he really was like, you know, let's switch you off that, get you onto morphine, which can't say it's any better, but you do have to take less. And I did tell him that first day, I said, my goal is to get off this, to be done with this, to not have to take a pill to get out of bed, to take a pill to have to go to bed, to take a pill to have to get off the couch. I didn't want to do it. And I said, there's got to be something else. I mean, got to be something. And he said, well, it's kind of new, it's kind of this, it's kind of that, but we can give it a try. And I thought, criminally, what could be worse than I've already had?
Based on what her diagnosis was, and again, based on things that had failed in the past, I knew that the stimulator made sense academically. I knew that it represented a possibility for her, a hope for her.
I was done with the pills at that moment. In fact, he walked in and I told Dr. Buchloz, I said, okay, you know what? Obviously, the spinal cord stimulator is the way I'm going to go. I don't care what it takes. I don't care how long it takes. I'm going to have this done, and I'm not ever going to take a pill again. The biggest fear you have is not getting off the morphine, not even getting the stimulator placed, nothing. It's that first day of the next part of your life where you have to realize, I have to rejoin the human race.
She clung to the importance of medications for the little relief that they gave her, but at the same time, she never lost sight of the relationships that she was losing out on. And so any possibility that seemed reasonable to her, she was more than willing to get after. And so she never lost hope. She never lost that sense of drive to continue to pursue other modalities. She wasn't willing to settle with what she was dealing with. And that ultimately was what I think changed her life.
To have it back is to skate with my kid when he plays hockey. That was fun. I couldn't do very well, but I loved it. To ride with my daughter. Can't get those moments back. I wish I could.
The most important thing that I do here is develop a relationship with people. It's not often for people who have been in chronic pain to have some horror stories of what they've experienced in the past when it comes to the medical community. There's a very good chance that they've had some trust issues in the past from some bad experiences. If people will trust you, they will give you the benefit of the doubt and consider reasonable treatments. And if they're willing to consider that, then there's always hope. As long as there's hope, there's always reason to think that things can get better than they are.
The biggest lesson is you really never lose yourself. You just see it that way. When something bad happens to you, you can't let it stop you. You have to keep looking on the bright side, and I know it sounds hokey and everything, but I really wish somebody would have, said, hey, don't worry about it. One day there'll be a difference. One day there'll be a change. One day something good will happen. Because I think I would have been a whole lot better if somebody would have just said that to me. That's my biggest lesson is if somebody had to do it again.
There is no better feeling than knowing that someone who used to have to schedule their entire life around their monthly appointments for prescription refills, knowing that that chain has been cut and they're back free and doing the things that they love to do. That is the whole reason why I get out of bed in the morning, and that's the whole reason why our doors are open. Anna went from someone that was literally on hundreds of milligrams of opiate medication every day to someone who is now completely off all medications. She went from someone who was having some family relationship strain because her personality had changed. And I think obviously it's tough to be your normal self if you're in pain all the time, to someone who recently was contemplating going skydiving with her children. So she's a much different person today than she was 5-6 years ago.